Do you really need to do 100 Kegels a day? We'll find out on today's episode of Taking the Floor.
I had this, misconception about Kegel exercises, right?
Because I did go into it thinking like, oh, I'm going to just do so many Kegels.
I tried Kegels maybe once, maybe twice. And what would happen is, I would forget the next day that, oh yeah, I'm supposed to do those exercises consistently.
Welcome to Taking the Floor, the podcast from Hinge Health about pelvic health, movement, and taking charge of your well-being. We're your hosts, Kandis Daroski
And Bijal Toprani.
And we're both pelvic health physical therapists here at Hinge Health. Thanks for being here. Today, we're going to dive into all things Kegels. And this is a question many of our members have. Do I really need to do 100 Kegels a day? You may have heard this, or maybe you heard that you should do 4 sets of 10 or 3 sets of 15. But is there really a blanket rule about Kegels that applies to everyone? How many do you actually need to do? And does everyone need to do them? We get so many questions about Kegels, and we're excited to break it all down today.
I think that Kegels have gotten a lot of airtime on Instagram and on the internet. And if you think about any type of pelvic floor exercise, Kegels are usually the most popular and the ones that pop into everyone's head. That's kind of the biggest question is, are they really what you should be doing for every single exercise? And, here's a little teaser. No, you shouldn't always be doing Kegels for every type of pelvic floor issue you have. So we're definitely going to dive into some of those different cases as we move on.
Yeah, I think it's funny, even like family and friends, when they here I'm a pelvic floor physical therapist. They're like, oh, like Kegels, isn't that's like all you do? And that can be farthest from the truth, but that's okay. We welcome those kind of questions. People come in and they have so many questions around it. How many should I do? Do I need to do these every day? How do I do one? Right? That's a question that we get a lot that I think people sometimes feel a little embarrassed about, even that they don't know how to do one, but we're going to just dive into all of that today and really hope provide a lot of clarity around this topic. I think the best place to start is if you want to know what Kegels are and how to do them, you first need to know what the pelvic floor is. I want you to picture a group of muscles shaped like a bowl at the bottom of your torso. They stretch from your pubic bone in the front to your tailbone in the back, and this is what we call your pelvic floor. And so if you want, it could be helpful if you're sitting to just sort of orient to where these muscles are. So if you're sitting, you can kind of feel those 2 sits bones on with pressure on the chair. If you sort of rock your hips forward, you can kind of feel a little bit more pressure go onto your pubic bone. And if you rock your hips back, you can feel a bit more pressure go onto your tailbone. So the pelvic floor stretches from those 2 structures. And then if you sort of tilt to the right and the left from, your left sit bone to your right sits bone, then you can kind of feel where the pelvic floor muscles would travel also that way between those 2 points. So it really does make up this bowl-shaped structure at the bottom of the torso. And like the foundation of a house, your pelvic floor muscles really support everything above them. And so this includes all of your major organs, like your bladder, intestines, stomach, uterus, and more. And like any other group of muscles, the pelvic floor can develop weakness. And if that's the case, intentionally contracting them, which is what we call a Kegel, can help strengthen it. And then the age-old question that we get is, how do I do a Kegel, right? And one of the kind of most iconic ways that people talk about doing a Kegel is sort of trying to conceptualize stopping the flow of urine, right? Which is partway true. There's lots of different layers of these muscles, and that trying to stop contracting the flow of urine is really kind of getting at those outermost muscles of the pelvic floor. So we want you to think about that, but we also want you to think about lifting or kind of visualizing pulling the vagina and anus sort of up into the body. So it's kind of a close and a lift up. And it's okay if that takes some practice. It can feel a little bit um, different if it's not something that you've tried before. And this is actually going to feel very subtle. You shouldn't really feel like you need to tense or squeeze other muscles like your abdominals or your glutes to do a Kegel, which is important because a lot of times people do this and then they lose a lot of that effectiveness of the Kegel exercise because they're actually sort of strengthening other muscles instead of that intentional focus on the pelvic floor.
Next, we'll cover why can Kegels be helpful. So it might seem obvious why strengthening your pelvic floor could be helpful, but it goes way beyond things like avoiding leaking when you sneeze. Let's talk a little bit about the other ways that pelvic floor strength can be beneficial. And a good way to do that is to talk about the functions of the pelvic floor. So there's 5 main functions of the pelvic floor. The first is providing support to your pelvic organs like your bladder and your uterus. It also provides stability to your spine and to your hips. And the pelvic floor is responsible for sphincter control. So that's a fancy way of saying that it provides a contraction or relaxation to empty your bladders and your bowel when the time is right, or it holds it in when you don't have access to a bathroom. And then there's sexual function. So your pelvic floor muscles are going to relax to make sex more comfortable and then contract during an orgasm. And then lastly, your pelvic floor also aids in circulation. So it helps pump blood that has kind of pooled in your leg just from gravity, go back into your circulatory system towards your heart. So those are all ways that your pelvic floor is going to function when things are going right and your pelvic floor muscles are strong and optimally functioning. But what can happen when your pelvic floor muscles get weak? That impacts some of those functions that I went over. So they might do a less than ideal job of supporting those organs that I mentioned, which could lead to pelvic organ prolapse, which is where one of those pelvic organs can kind of slip out of its normal position and start to bulge into the vagina. You can also end up with hip or low back pain, or have bladder leakage with running or jumping, or just a lot of urge to have to go to the restroom. You can also end up with some pain during sex, maybe during the insertional phase or even with deep penetration.
And not all people need to be doing Kegels, but there's certainly groups that could benefit a ton from it. And some of those things that you just mentioned, Bijal, things like urinary leakage, or if you're experiencing, a lot of vaginal pressure from pelvic organ prolapse, and even certain times of life, right? So when we think about menopause, this is a time in our life when all of our muscles throughout the body are starting to, get a little bit smaller and lose some strength. And that's a really great time to bring your, intentions back on really strengthening the body, including the pelvic floor. And then also from a prevention standpoint, and this is a question I get a lot, is like, I don't really have pelvic floor issues, but should I be thinking about the pelvic floor in, my workout programming or in my day-to-day life? And I'm always an advocate for that. I think the more that you can connect with these muscles and learn to intentionally strengthen them is great. And it's only going to serve you well in the long run. And then, something that really comes up often for people, especially if they are experiencing symptoms of urinary leakage or pelvic organ prolapse, and they don't have a history of childbirth. Sometimes they're often like, well, what did I do? Why did this happen? Isn't this something that just is exclusively a problem of pregnant people or people that have had children? And the answer to that question is no. It doesn't only happen in those individuals. It can happen from things like long periods of being sedentary, right? Just general weakness of your muscles. It can also happen if you over time, maybe use less than ideal lifting techniques, right? And you're really like bearing down on the pelvic floor and holding your breath while you're lifting. Or even conditions that cause chronic coughing can place a lot of stress on the pelvic floor and cause them to become weakened. But they, of course, are very helpful also for people that are pregnant or have maybe had children. And the way I like to think about it is, during pregnancy, your pelvic floor muscles are really having to like work on overdrive, right? Now, we're now carrying around an 8-pound bowling ball in our pelvis by the end of it, and those muscles have to really hold that up. And over time, they can become overtired from that experience and perhaps a little weakened. And then, of course, if you've had a vaginal birth, that can also really impact the pelvic floor muscles. They have to really stretch during that process. At times, they can also tear. And after you get over that initial healing process of birth, think of these muscles like any other area of the body where you would maybe have had an injury before, where you're going to want to let them kind of heal, but then you're going to want to go back into this sort of like more rehabilitative or restorative phase where you're really focusing back in on strengthening.
Let's dive into who shouldn't necessarily do Kegels. Kegels aren't a cure-all, and just because you're having pelvic floor symptoms doesn't mean that they're the immediate go-to exercise. For certain people with pelvic pain, for example, or with trouble relaxing the pelvic floor, they may not see any Kegels in their program. You might be someone who has a hard time relaxing your pelvic floor if you catch yourself always kind of holding your abdominal muscles in or clenching your butt. It's pretty common for women to do this. If I had to guess, it's probably because we have a lot of stress on ourselves to kind of look thin, and so we tend to suck it in, or kind of stay in this really tight fashion with our abs or our glutes. And that can really cause tight pelvic floor musculature over time. And so Kegels might not be the right exercise for someone who I just described, who kind of has, a lot of tightness of all of those muscles. And then, of course, things aren't always black and white. So there are many kinds of pelvic floor disorders, and you might have a combination of situations going on. So you may benefit from both Kegel exercises and then also more relaxation or more released focus exercises. This also comes up a lot with our members.
What I know now that I wish I knew before could probably fill a small book, to be totally honest. I think that the biggest thing is just going back to pelvic floor health, not just being your pelvic floor. There's so much more to it than that. I wish I had known that, because it is so important. And if you're just sitting there doing Kegels and you're missing this whole other part, you might feel frustrated and you might feel like it's not worth it when you're just missing that next bit, that next puzzle piece.
The number of times that I have spoken with women who are like, I've already been doing Kegels and I'm not getting any better. I could fill a small book with that, because I think it's often just the easiest thing to try first. You can find a lot of information about it online. It's not uncommon for doctors to kind of, give a little handout or something like that. But it is about so much more. And we'll kind of get into that in a little bit about some of the different areas of the body that are connected, and how when you're just doing Kegels, you're just really limiting your potential to really improve so much. And when you expand it, there's such a great opportunity to improve. But let's say you are someone with pelvic floor weakness and Kegels are the right exercise for you. Back to the big question, is 100 Kegels a day really the right number? I don't want to frustrate anybody, but there really is no magic number. And that can be hard because when we're dealing with symptoms, we want to know the precise recommendation, right? Because we're all in, we want to get better. We want to know exactly how many of these things we're supposed to be doing. But it is situational. And there may be times in your life when you really need to buckle down and you need to do your Kegels consistently to really reconnect to the pelvic floor, or to reduce symptoms that you're experiencing. But the fact of the matter that I really want to kind of just remind everybody about is that the pelvic floor are just like other muscles, and all of our muscles are working at some level all day, right? So even though you're not consciously thinking about it, the pelvic floor is working, throughout the course of your day. So if you're doing your Hinge Health sessions every day or even a few times a week, and you're really keeping that awareness on the pelvic floor throughout your day, you're doing great. You're on a good path, and you should continue along with that. But the kind of age-old question that I get often is, should I expect to be doing these for the rest of my life? Is this something I'll have to do every day for the rest of my life? And as you practice and learn how to do a Kegel in all of these various positions that we teach you and during other movements like squats or lunges, it's going to become so much more automatic to you. So my answer to you would be yes, you'll technically be doing them, but it won't feel like you have to concentrate on them so much. And that's the eventual goal, is to really return your body to that sort of automatic behavior, right? Where the pelvic floor is sort of working in the background and doing the thing it's supposed to be doing.
Next up, what are some variations on Kegels and why can they help? So, like all exercises, you can approach an exercise or prescribe an exercise with different goals in mind. These goals can include gaining strength or improving endurance or coordination. That's why Kegel exercises can vary in how many seconds you're asked to hold the contraction or how many reps you do in one session. You can also do them in different positions. For example, starting laying down on your back with your knees bent, and then progressing to doing them seated in a chair, and then to a standing position. That sequence starts with the easiest and gets progressively more challenging. And with all physical therapy exercises, regardless of the body part, our goal for our members is always to improve function. So you may progress to doing these Kegels in more functional movements, like during a squat or a lunge, or while getting in and out of a chair.
And finally, what else should you know about Kegels? So, a hill that I will die on as a pelvic floor physical therapist is that Kegels should not be the only exercise in a well-rounded program. The reason being is that the pelvic floor is so interconnected to other muscles within your body, namely your abdominals, your low back, your hip musculature. It is so connected to those areas. We need to be sure that we are strengthening and keeping flexible those other areas of the body. Because they're all connected, if one area is perhaps a little bit more weak, then the pelvic floor might have to actually kind of like take up some of that slack and work a little bit more into overdrive. Another scenario might be that if something like your hips or your low back are too tight, and then, that maybe impairs how well the pelvic floor can actually function. And I think we see this also when people are really working after Kegels for a really long time and they're kind of just working on that one component and they're not seeing the success that they want to see. Their symptoms aren't reducing, they're not feeling stronger. And then they add in these other components like core strengthening, flexibility around the pelvis area, and breathing, breath work. And then they all of a sudden see this huge difference in their symptoms. And it's because it is so connected. And so this is why you'll see in your programming here at Hinge such a variety of exercises, because it really is the most effective way to treat urinary symptoms or pelvic floor issues, and just in general improve your your overall pelvic health.
Let's go over the 3 most important things to remember from this episode. First, Kegels are not a cure-all. They may just be one element of your exercise therapy, or they may not be part of it at all. But they can be really helpful for improving urinary leakage, improving overall pelvic floor strength, and treating pelvic organ prolapse.
Second, there's no ideal number of Kegels to do in a day, and the right amount for you depends on your pelvic health symptoms. Your Hinge Health program incorporates Kegels in many different exercises, so if you're doing it at least a few days a week, you're getting enough.
Finally, here's a helpful check to know you're doing it right, but not overdoing it. While laying down or seated, squeeze the muscles around your vagina as if you're stopping the flow of urine or picking up a marble from the ground with your pelvic floor. The move is very subtle and should not cause movement of your hips.
Taking care of your pelvic health is something that we like to call non-negotiable. It's just as important as any other aspect of health. So let's just do a quick check-in on how else we're really taking care of ourselves this week. Bijal, what's your non-negotiable this week?
Okay, I'm really stoked about my non-negotiable because I am reading a new book series called A Court of Thorn and Roses, or ACOTAR for short is what I've heard. And it's a 5-book series and I'm on the second one. And so for me, something that's a non-negotiable is that I always end my day reading a little bit. It allows me to just kind of like close out the day. It like lulls me to sleep. So my non-negotiable is reading tonight before I go to bed. What's yours?
I feel like people that know me would argue with me about this, but I'm like very active. I love exercising and those sorts of things, but I do it in like such pockets of time. Like I do all of my exercise at once and then I'm sort of just at my desk for the rest of the day. So I want to make sure that I'm just kind of getting like consistent movement throughout the day versus all in one chunk of time. So I'm going to just try to get up and move every, hour and a half, 2 hours, do some stretching, even if it's literally for 30 seconds. So I'm really focused in on that this week.
That's a really good goal. I'm glad that you mentioned that. I've been trying to drink like smaller cups of water, so I have to get up and go fill it up instead of having like a giant bottle that allows me to sit at my desk for hours. So that's a really good one. All right, everyone, thanks so much for listening. If you have any questions about Kegels or any other pelvic floor exercise, be sure to reach out to your care team in the My Care section at the bottom of your app. Remember, if you're dealing with pelvic floor issues, you are not alone, and we are here for you. The information contained in this podcast is intended to be used for educational purposes only and does not constitute medical advice or treatment for any specific condition. Please consult with your healthcare provider with any questions you may have about your medical condition or treatment. Check out our Hinge Health app library for new episodes coming soon.